recording, so I will send you to the same email that we sent your confirmation. I'll send you a link so you can review this at any time and use this as a reference guide to learning the program when you are anytime you want to kind of have a backup. Okay, perfect. So yeah, so that'll be for the other doctor. He can watch the beginning of this after that, on that recording. So just to start off, this is the main login screen for our demo account. It'll first thing is the upper right drop down. So when you first log in here, it's going to take you to your URL. It'll take you to this screen, and this is you will log into the doctor side of it, obviously, because you are the doctor group that is using the system. But there also is a patient side of it. Now, you don't have to give the patient any of this information because they get that automatically from the portal that is sent to them in a link. So they're going to be getting that access to the secure patient side of the system to do all their data entry, agree to your intake forms, all that. When you first log in, you go to what we call our dashboard screen, and then the overview, which will have today's appointments located. That's where you can check the patient in, start their exam, etc. You also have access to recent unfinished orders and exams at the top here. So just organize all that for you. So it's easy to keep track if you're running late for a lunch meeting, you come back, which ones you didn't finish up, etc. You also at the top will have the store locator. My understanding you have one store, so it'll be just that store that shows up here, which is easy. And then you have settings for that store. This is where you're going to go through, right now when you first start the program, and go through and update pricing for procedures, default billing information, provider information, prescription expiration dates. And then we also, if you have any devices, you'll have integrations located here. And you can email our technical support team if you're trying to integrate any like pre-testing equipment, and we can make sure that that's set up for you as well. We have inventory. So if you do have any products at some point, that will be located here. And then you have communications. So the system automatically includes appointment reminders and recall with text confirmation. But you can also add on communication tools such as our VoIP phone system, similar to what Weave offers, but it's all integrated and a lot more affordable, as well as two-way text messaging. So you can have full conversations with patients through that text messaging feature. The phone numbers will be located here if you have those active. The contact list is important because you're going to build this out, and this is going to be so you can communicate outwardly from the program through an integrated fax or email. But the fax obviously is the HIPAA secure route. And that's what you do is put in, say you want to put in a new contact. And what you do is you click create. Let's say you put in Costco pharmacy, right? I already have one in here just to show you. And then you put a fax number and then you save it. And then that Costco pharmacy will be in here, as you see, number 2, with their fax number. So that's how you can do e-prescribing, do referrals to a doctor, do communication with like a rep, a contact lens distributor. You would make them a contact and put their fax or email. And then in the system, there's several areas where those pop up where you can utilize it. The e-prescribing, the referral generation, all that's done through the contact list. Okay, and that's located in the store settings under contact. You have the schedule, which you're going to set up. Here it's very easy. The recurring schedule is here where you put the day that the time you start each day, as well as breaks. Any one-offs can be done here by just clicking per day and then highlighting the date and changing that schedule. You have staff management, so you can go in and add staff members, remove staff members, edit the privileges they have. If they're not a super administrative level, then you can actually go through here and change and remove what they can do and what they can't do by doing just assigning and unassigning specific levels of privilege, basically. So that's all of your store settings, again, located at the top here. Next to that is your search bar, so you can find patients inside your system very quickly. You're going to be able to see the patient's important information underneath there. And then you have data tabs. Under the tabs for the data, you have first the overview, which has all their chronologically ordered data. So you have appointments, you have exams. All you have to do is click show and it'll show those. And then you can get into an exam, get into an appointment, and get into an order. It also has a ledger of the patient's financial history. So it does keep track of everything for you very quick to see what they have for payments, any receivables. You have intra-office notes. This is stuff that you can write that the patient can't see in their account, right? This is just be shown right when you log in over here as well. You have family members that can be linked. So if you want to link a family member, you just simply search the database, find the family member you want to link to that patient, and you can put the relationship and save that. And that'll let you then allow access to the patient's portal, the profile. So that's where you do that under family member. Reports will list all their previous generated reports, prescriptions, invoices. And if you want to print it off, you just go here, go to the print button. If someone calls and they want a copy of their prescription, they already have access to that in the portal. So what you can do is go to their account, go to the thing they want, and then click this little airplane. And that's going to pull up the email they have in their account already. And you just click the little airplane. It sends them an email to log in securely to access that. So it's all HIPAA secure, not emailing patients protected health information through the email. It's all done through the portal. The account info and history, all this stuff is going to be coming in from the portal. So obviously the name and things are put in when you schedule them, but anything else that is going to need to be done by the patient will come in and it'll load in here from that patient's history, their review systems, all from their portal. There's a whole section for documents in this section. This is where patients' previous EHR notes will be uploaded. Any documents that you want to scan in, upload, annually. There's no data stored, so you can put them in here and document tag them. So it's all located at the very end of the document section for documents. Let's go back here to the dashboard. The patient scheduled today, we'll show you how an exam works right now. So if a patient's on the dashboard, you can click their name and go in their account, very easy. You can also text, call, or WhatsApp. We have that as an option for communication as well. So if you have those active, to do that, if they're in the dashboard, you just simply click it. And you can send them a text message if you have two-way text message activated. You also have an area where you can add comments. Let's say running late, 10 minutes. You can put this in here and it'll save it into it. You can also write it when the patient makes their appointment, right? So the way the patients make appointment is on this section. You have customization on how the appearance will look, obviously color coding it, having all the doctors show at once or one doctor at a time. You also have in your settings, the default how it's going to show you the week, the day, the month. Okay. So to make an appointment, very simple. All you do is double click a slot, and then you can search the patient here or add a new patient by putting them in here and then saving them. Now, it also asks you how the patient wants notifications. This is important because you're going to get the patient's confirmations and their portal links sent to either their email or text message. Obviously, it's best if you do all and they have all that data in here so that the patient gets all communications. But they can obviously select based on the FCC regulations what they want. You can even remove it and say no communications onto their account. So once they're on the calendar, if it's a current day patient, they're on the dashboard. That's where we can check them in. That's where we can start their exam. Now, if they didn't do their portal, it's going to remind them progressively to do it once they make an appointment. But you can also do things actively. So the day of the appointment in the morning, your staff can go down here to appointment reconfirm and click that. That's going to send them a notification again manually via text or email or however they have it set up to then do their portal. And even if they don't do that and they come in, you can click this feature called sign up. And what you would do is get like a tablet or a computer station, go into the system and then click that for whichever patient you want. And it's going to take you to their patient portal. So then they can do it electronically in the office, hand them the tablet, let them do it, and then they hand it back. And then once they hand it back, you log them back out, and then you can do it for the next patient that's needed. You can also just do their exam without the portal stuff anyway, so it doesn't really matter, but it does give you a lot of options. So let's go ahead and start their exam. So you click create exam. At this point, it gives you the option to add procedures, remove procedures, change their appointment type, which is really helpful, right? So say that they forgot to put on a refraction or contact lens fitting, you can now create the exam. It's going to take them into the chart. The chart node is really easy to navigate. You're going to have this header that stays at the top the whole time. The complaint will be up here. Let's say they have blurry vision. This is also where you it'll automatically go into a template that's been assigned to that specific CPT code. So in your settings, I'll show you, you can customize which templates open to which exams, but you can always change it here also. You can also review previous exams with one click and change their recall date if you want at the top. Generally, it defaults to 1 year exactly after the current date. The next section here is the exam sections. The overview is simply a summary of all these other sections, and you can scroll through the whole thing and do the whole exam on one scroll, which is really helpful, right? You don't have to click, each section, or you can jump right to a section here. So let's go to the history of present illness. The patient has the blurry vision. It pulls in from the chief complaint. We also have these data entry memory features, so it will remember options and give you suggested drop downs. We also have the social history, med history, and review systems. All this is coming in from that patient portal. Now, again, if you don't want to just jump to each section, you can just simply scroll and it's going to go through each section and take you to the next section. So you have preliminary testing, binocular vision. As you see here, this patient has data in it. So we have a couple of time-saving features built into the system. First is on existing patients like this, you're going to have copy forward data from their last visit. That allows you to change anything that's different this time simply by just removing it and then picking an option or writing it free text. If it's a new patient, you have the option in your templates to designate normative values to pre-enter on new patients. And I'll show you where you can do that. So anything you want, now to just pre-fill normal and then you change it, you can do that in your settings as well. Another feature that's really helpful is your info button. Every section has this little info button. You click it, it's going to show you, based on which date you select, what those data values were, and you can always import them into this as well. Really helpful to review data without having to open up another chart like most systems require. You have next the refractive and contact lens. Now, in these templates, as you see all these sections, all this stuff is customizable. You can remove, add, test, all that in your settings. I'll show you that too. So the refractive contact lens section, you'll see you have the lensometry. If they had a previous one, it'll show here. Then you can copy that over to the subjective refraction. The subjective refraction can be copied to other areas to then finalize a prescription. To change the values, you simply go here. You can just simply pick the values from this grid, or you can manually type it in. You can also copy between eyes at the same time. There's also, if there's no values here from a pre-filled previous value, you can click 2020 and fill out all of them at once. So let's say you're happy with this subjective refraction. You're going to finalize their glasses with one click here. That finalized prescription is located on this section. And this is where you can edit it. Let's say that's their distance prescription, but the patient also wants a pair of readers. You simply click add new. You go here, you can change it now. Let's say it's a +1 reader in each eye, and you can say now that's their near prescription. So that's how easy it is from the refractive area to then finalize and edit prescription. You can remove them and change them all in that section. On the bottom of that same area is your contact lens fitting. So if you scroll down, you'll see that here. This is the lens they were in before. Let's say you want to put them in a new lens and not the same lens this year. You click add new. It's going to take you to the new trial down here. All the data will be copied forward. So all you have to do is find a new lens, pick the power. All the base curve and diameters will be pre-filled automatically. You just simply have to pick the power you're going to fit this patient in. And you can always copy between eyes as well with these buttons. Another thing that's really helpful is the rolling feature. You have the ability to, obviously, yes, someone else is coming on. You have the ability to draw areas for the toric lens markings, etc. So it is very easy for you to just do drawings on this diagram without opening a whole new window as well. You can make notes in here that are just for the intra-office, so just for your office staff, or notes that go onto the chart itself. So that's the difference between those. You, again, have these 20/20 buttons if they see well, or you can pick an acuity or just manually type it in. Another good thing is there's an area to add these lenses you're fitting to a running list of trials that are needed. So all you got to do is click that. Those lenses are then added into that list if that's it. Saved, so you can organize your trials without having to keep a field tabs or like a sticky note, right? It's all done automatically by selecting that. Now let's say you're happy with this fitting. Click finalize here. If you're going to trial it, you just don't finalize it. This data will copy forward to their follow-up, and then you can finalize it when you're happy with the lens you're fitting. So now we have a finalized contact prescription. This is where you can edit those prescriptions here, change recommendations, expiration date, etc. Same area. The next is your actual anterior and posterior exam of the eye. You'll see the previous data that's copied forward. Again, if you want to review stuff from another date, you simply go here, see what it looked like before, and you can import that image. So it's nice you can follow the progression of their disorder without having to open a previous chart by using that info button. If you want to draw in color, you can do that here. Let's say that pinguecula or something. So it is really more realistic charting. You can draw on it. If you have a tablet, you can use your finger, you can use the mouse, draw on it. You have the anterior corneal diagram with designations as well as a gonioscopy. If you ever do that, you can use that. And then you have the anterior lateral findings. Again, this is copied forward or normative new patient data that'll be there already for you, and you can change anything that's different. Anterior angles with intraocular pressure next. This is all customizable. Whichever test you use, you can change it in the settings. And then you have the internal exam of the eye with the same color coding drawing features here. Now, if you want to close a section or open a section, it's important to know how to do that. There's this little arrow, so I just closed it by clicking it. You click that, that'll open it back up. So that's, if you can't see a section, just go to the right side of that section and click the arrow to close or open it up. Again, so here's the drawing feature. You can draw on the back of the eye, draw in color, or draw black and white, however you want to do it. Draw the optic nerve cup. And then your lateral findings for the posterior segment. Dilation is here. If they say no, you can have a default message that will come in from your settings. If they do dilate, you click yes, and then you can select the drops from your settings that you have, as well as the timestamp. This is a good spot to show you some of these built-in features that utilize that contact list. So here's a patient that, say, has conjunctivitis. We want to go up here to more actions, go to e-prescribe, search the ICD-10 database for why you're treating that patient, and just search it here, unspecified conjunctivitis. Search the medication database for the one you want to treat. Let's say 5 milliliter prednisolone acetate 1%, and then you want to do dosage QID. And then do you want generic? No, no refills. Click submit. That'll create the medical RX in that same tab. And you can use it however your state allows. If you're allowed to print off a medical prescription and hand it to them, you can do that. You can also electronically submit that to that pharmacy through the contact list, like the Costco pharmacy we have in here. So it's all based on whatever's in your list, like your email account, your phone. You have to have that contact list built out. You can always add people. You know, it takes 1 second to add a contact, so your team can do that at the front desk. So that's all done. So it's super quick, and that's all included on that e-prescribing platform that's part of our system. Let's go ahead and finish the exam. There's a whole section for additional testing. So if you do any pre-testing, you know, retinal photography, scans, visual fields, you can, for example, I have an OCT I can upload into here. If you have a previous one you want to compare, you can also look at it here like this. I can also import it if I want. So this is that patient's OCT I did another day. You can write your interpretation of it, and then it'll save the thumbnail of it. And if you want to open it up and review it, you can see the full-size image here, and also print it off of the system. So it's really nice. All that high resolution imaging can be saved into our system. This is all customizable too. You can change whatever test you actually have. Now on the procedure, impression, and plan tab, this is going to save you a lot of time because it automatically pushes through the procedures. Anything else that you did can simply be added in at this point. Let's say the posterior OCT that we just did. And then if you scroll down, you're going to see there's some auto coding. So we do use AI technology to read the refraction and also that medical RX that you created. It pulls that automatically in, and then you can select a plan that you've used before. You can also edit the plan if you want to change it to something that's different or that you want to add in addition. Let's say return in 1 week for this medical issue. You can even change the order of these. So if, say, you're billing medical or refractive, you can move them around with the mouse just by dragging them and moving them around. So at the end, you're going to be all done. There's a whole section for attached documents. If you want to upload, say they bring in a DMV form or a Ambler grid or something that you don't have a spot for, you can upload that as well. So at the end, you're going to click finalize exam. That's going to then create a locked chart, scroll down, everything summarized, their history, their anterior, the intake information, any refractive data, followed by their anterior segment, posterior segment, special testing are summarized, and then the procedure impression plan, followed by any finalized prescriptions, and then the electronic signature of that provider. So at this point, you're all done. You can go straight to checking them out from here, or for most offices, you're going to close that, and now your team can check them out. Now, you do not have to finish an exam to check the patient out. It's simply noted that the exam's been finished. They can check a patient out even before you start the exam if they want. They go here, click create order. It lets you know you're creating an order. You click yes, and now you're in the order. Very similar to the exam. You have a header at the top. You can change, different areas for like the insurance that you're using for that patient. a promise date if you're giving them something that's materials. For you, it'll be just exam procedures, so it's super easy. You go straight here, it automatically pulls in the procedures from the exam. If you are doing insurance billing, you can put co-pays in here as well, discounts, all that's done here. Entire order. So if you scroll down, it's going to show their impression, ICD-10 codes, followed by their procedures and co-payments, and then their balance due. This is where you check the patient out, right? So at the top, you click finalize order. If you do have the integrated payment processing feature that we have, which is called iTRUST Pay, and you can add that on in the system. I'll show you where you do that. You can run cards through the program. If you have a side-by-side terminal that you want to keep, you can do that offline with this button. Let's just say this patient is paying cash and has insurance, so you can see kind of how the billing features work for insurance. So let's say they're paying their full amount here. We're going to do, let's say, $255. And let's go ahead and check them out. So now we'll click pay. It shows that their balance due is $0 up here at the top, and their total payment. And this is now where you have some options. So you can click a claim, create a claim form if you're going to do insurance billing. Currently, this would be just for medical clearinghouse integration, or you can print off the HICFA form, downloading it either text or just a PDF of it. Also, you can integrate with our in-house EDI clearinghouse that we offer, or TriZetto, a finished order. You have options up here. You can refund, you can email them the invoice, print the invoice, download it. But again, this patient has access to this in their portal, so you don't have to do anything unless they request it, right? And they also sign that they get electronic access to their prescription, so you don't need to give them a copy of it unless they ask, because they sign that they get that. It satisfies the FTC rule that they get access and acknowledgement that they have access. So they sign and date that in their portal. So let's go ahead and close that. We've done an exam, we've done an order. Now let's finish up by going through these tools here. So I've shown you the appointment calendar, right? This is all customizable in your settings. I'll show you that. You can go through the exams with different filters, date of service, the impression, the type of insurance, etc. Here. You can also sort it by unfinished, finished, or recent. You have orders that are broken down into different sections. Obviously, if you're doing materials, that would be broken down more here, but you can go through here and see any unfinished, filter by date of service, status, etc. Patients can be sorted here by keyword or also recall date. So you can see everyone that needs to be recalled. If you want to sort it and put on a spreadsheet for like mailers, you can do that all here as well. Payments are broken down, really important ones, insurance balance due. This is where your revenue cycle management team or billing team, anyone who's going to do recording of insurance payments would come, and they can put in how much the insurance paid, the check, and notes on it. They can also change the status. It auto posts if you do have that integrated clearinghouse, that it'll post to being billed, and then you can come in when a payment's been made, that it's been underpaid, fully paid, etc. And then all this can be exported out to CSV format. You can also batch out claims here by just selecting the ones you want to do. If you want to batch out everyone from one day, you go here and you can send it to the clearinghouse this way as well. Another thing that is important here is your day report. This is where you come to see the performance of the office for a specific date, location, all done here, and you can download it off of it. So this is your Z out, the end of the day. You also have a selling report. This is a performance report that you can run filters on based on by the user, by date of service, by the insurer, etc. And then you can run that report and download it. But it also creates KPIs based on those filters, shows you your revenue per exam, all these things. So you can run that and see basically performance indicators and download for logs. That's everything that's going out of the system is logged. So communication from email, text, fax. If you want to confirm something was sent, that's all done here. It's the two-way text messaging, the merchant processing feature, the clearinghouse integration, WhatsApp if you want to use that. So let's say this patient that you did the exam on, you want to do a referral to another doctor or send a note back to a referring doctor. You click their name, or you can search their name in the search bar. Obviously, go to their account and go over to the exam. So if you want to see the exam we just did or a previous one, you go into that exam. And to do a referral, and you can do it while you're in the exam during the actual exam itself, you go up here to the More Action tab and click Referral. You create new. It's going to automatically select the entire exam to summarize. You can take out sections you don't want, and then go to Referral Detail, and then put in the details like a retina specialist here because the patient had, let's say, a tear in their left eye. And then you go to your contact search list, and let's say you want to send them to Dr. iTRUST, who's the retinal specialist. And then you have the option to notify the patient of that referral with this, which means they'll get a text or an email notifying that a referral was generated and they'll log into their account to see it. And once you click save and send, it does three things. It notifies the patient if you have that selected, it creates the note, and it faxes that note to that provider. And you can also see the note here and print it off if you need to. And that's nice because if the patient's in the office, you can give them a copy right there. But it's also located in that patient's account, right? So if you want to go into that patient's account and see the previous referrals that we generated, all you have to do is go here to reports and go to referrals. And then here's today's referral note. So you can download that off as well. But again, the patient can also access that in the portal. So let's finish off with the settings. So you have two areas, the store settings, which I showed you earlier, and then the system settings. This is where you're going to customize a lot of the exam template and messaging and all that here. So let's go through that. First, you have the exam form builder. This has a lot that are already defaulting in the program. If you want to edit the ones we have, you can do that here, or you can create one from scratch with this button. Let's just pretend we're editing the default, which is assigned to these procedures. This is where you would change what procedures are going to be assigned to which template and edit the actual template. You click the little editing tool. Here's where you pick the procedures that will open up into that template, right? You then can take sections out of it if you want, add sections by selecting this little areas here, and then click save and next. That'll take you then to the different sections of that template. History of present illness. Again, if you want to edit something, you can do that here, change the name of that section, etc. You can put in defaults. So this is where the defaults are changed and saved. Once you save something or remove it, click save up here, and it'll then translate to the next patients that are new. It'll put that finding in automatically. Okay, so that's where you do all that. Here you have then the defaults for the actual exam itself. That's where you can go in and color code the procedures, change history items, allergies, surgery items, medications. So there's already obviously a ton of stuff in here, but if something isn't in here that you utilize that's maybe obscure, you can add it as well. Your impressions, your recommendations for the patient's lenses and glasses, dosages, of course you can add more in here, and then medications, same thing. So this can be edited, added, etc. Message settings, this is your appointment reminders, your recall, all of that's here. Just to give you an example, here's the day before reminder. This is able to be turned on and off here. You can edit the actual reminder by clicking the editing tool. This is a text message, this is the email. Anything not in double brackets, you can edit, just go in here and change the message to your liking, okay? But the double brackets pull in data from the system, so don't change that. You can also create a new one at the top by clicking add new reminder, how far before or after, how many days of an exam, right? And so this lets you create custom reminders to patients as well. The exam is the recall, right? So if you want to go to the recall reminder and edit that, that's here. You have, other ones you can look through, patient stuff, like, sign up message, you want to leave that on. That's when they make an appointment, they go through the portal, etc. The patient settings is the portal. You can edit the whole portal, right? Edit the questions that are in the portal here, edit the intake forms. So we already have a HIPAA form that's defaults, as well as that FTC acknowledgement form, but this can be changed, removed, or added under your settings. So if you want to add something else in here, you have the different areas of the history that you can change as well. The headers for the reports can be edited. And then there's this survey. This is an email that goes out 24 hours after their visit that basically is an internal survey asking them how their experience was there, and you can get those back into the system. There's also a section for calendar settings. This is where you would edit the slot frequency for exams, how many slots per appointment. The online booking feature, if you want this active, you can edit the settings here. So what this is, it's a online booking feature similar to something you can put on your homepage or on a QR code or a sign even in the optical of your office, that someone can go to the QR code. It takes them to this link. And the link is simply a online section of your calendar that, based on your settings, allows a patient to schedule themselves for an exam. So they can see appointments, see the doctors that are available, and then they can go through. And this is, again, limited based on your settings underneath that. So they can only schedule certain things and how many exams or how many days out you would allow someone to schedule. If they do schedule, it'll email the office notifying them, and it'll also put them on the calendar with a little icon next to their appointment. So if we go into the appointment calendar, you see at the top here, this thing where it says anonymous, it'll have this little icon next to it notifying that it was done online. Basically, it shows like a phone that someone scheduled themselves. Okay, so that's all underneath your calendar settings here. If you do want that, the team will send you a link. It's basically a hyperlink that your IT person can add to your website, or QR code you can add to your signage and business cards. Then the last thing is your insurances that you're going to take in the office. So you're going to go here, go to vision insurance, put in the companies that you take as well as the plans under each company. And then that will then allow you to then assign these to patients. So this needs to be added in when you first set up the system to make sure that they're accurate. And it lets you put in your detailed information, your payer ID and all that good stuff here. When you are learning the program, one of the best tools is your online user manual, and that's going to be here. You can go through and just find a topic and see a video or step-by-step guide, or you can search the topics at the top here. So it'll basically answer almost any question. We've built this out, from frequently asked questions from users, etc. We also have a YouTube page, iTRUST EHR, with some training videos. But really, the most specific would be searching the online manual, and that's again all accessible here. You also have the billing area where it'll show your breakdown of pricing for add-ons, etc. But if you do add on any add-ons, you'll see those added here in your summary as well. And then your support you can access here. So if you have an emergency, we have 24-hour support. And then we have an email if you want to email our support team any questions. Another thing that's helpful is your IT ticket generator. So if you're having some kind of issue you can't figure out, you can create a video, a picture, or just send a message to the IT team in the notification. Then you can click that and it'll show you the tickets, and you can see kind of the outcome from the support team. So that's again all accessible just by these three dots on the bottom. Just click that and open it up. It also has a app tour. So if you really have a new team member that wants to learn something right from the very beginning, this will take them through some very basic functions on how to do appointments, create a patient, create an exam, create an order, and then activate the account. So it's more for people when they're first starting off, but new team members can do this. It's really helpful because it walks them through a training, kind of like a AI training guide here. And that's all accessible under those three dots as well. If you go up here to their editing their profile and you see where it says merge patients.
Yes.
You can search for another patient that's in the system and then merge those two accounts so the data will go together. So that's, otherwise